It's not meaningful if a patient has to have 36 hours of radiosurgery. With marvelous techniques on the linear accelerator, we can perform treatment of 10 metastases in no time at all, in a half an hour.
The current mode of practice to treat multiple metastases is to treat one after the other. And you can certainly do that. On a gamma knife, you would do that. Conventionally on a linear accelerator, you would treat one after another. And that treatment would take 15 to 20 minutes for each one. And so if a patient came in with 12, you can have the patient being treated on the device for 3 hours, 4 hours.
That might not matter when it's 2 or 3 tumors, but if we come to a point where we want to treat 10 or 15 tumors, it's really inconvenient to treat them one at a time, and it's a lot easier to have a technology where they can all be treated at once.
Historically, treatment planning has been a manual process that's done with the knowledge and experience of the physicist who's sitting down at the computer. And you go through this manual, iterative process until you get a plan. Not the best plan, because, you could probably spend some more time to make a better plan, but you get what's a clinically acceptable plan. And there's no reason to do that once we had computers that can do this optimization automatically.
New approaches allow us now to treat all of the metastases with a single isocenter. And one of those techniques is called volumetric modulated arc therapy. As we are rotating the gantry of the linear accelerator, we can create very complex openings to allow irradiation of all of the metastases. Depending on the orientation of the multi-leaf collimator, it may be challenging to actually create 2 separate apertures without creating an unwanted region of exposure in between. Another technique that is gaining popularity takes a different approach in choosing subsets of brain mets to be treated in a single gantry rotation. Let's imagine a patient who has 7 brain metastases. The algorithm would look at that set and decide on maybe 3 of the 7 to be treated in a single gantry arc. And then in a second gantry rotation, the algorithm might choose the remaining 4. And that decision would be based on minimizing the area or amount of normal brain tissue that would have to be exposed.